at your neck. Abnormal findings in asymptomatic subjects. These are people who have no symptoms. Of over 1,200 subjects without symptoms in their 20s, more than 70% of the men and almost 80% of the women showed bulging discs in their cervical spine. But no symptoms, no pain, no problem. Again, we'll see a bulging disc. We'll assume that's the reason for the pain. Now, sometimes it is. So please don't hear what I'm not saying. I'm not saying it's never the case. However, we cannot diagnose and treat based on an MRI image without getting lots of other factors into the mix and a thorough assessment of the person's entire being and not just focusing on that body part. We need to make sure that that pain culprit is not somewhere else, right? So looking at discs and degenerative disc disease, 20 to 25% of people who have no back pain at all show a herniated disc on imaging. 60% of people who have no back pain at all show degenerative changes in their spine. So we cannot just assume that what we're seeing on imaging is the reason for the pain. How many people are sitting on their backside 15 hours a day and their power source is completely gone? That's why they have pain. It's got nothing to do with what's showing up on imaging. Now, sometimes it is, but it's a heck of a lot more rare than what we're giving it credit for, right? Here was a study done at the Cleveland Clinic, and this doctor ordered MRI from patients who had back pain or leg pain. And I believe this was from a whole, I think it was like 11 different clinics, and it was well over 1,000 people. 13% of those patients showed that those herniated discs worsened in 6 weeks. I mean, the MRIs proved it. Oh my gosh, that herniated disc is getting worse. 15% of them showed that the herniations actually resolved, which they will. Data shows that a herniated disc will resolve itself within 1 year on average, at the longest 2 years. And that's with no intervention at all. Now, nobody's going to want to be in horrific, severe pain if the herniated disc is the reason for it for 2 years, right? But that's what the data shows. So this particular study, discs improved in 15% of the people, worsened in 13% of the people. Here's the interesting point. There was no relationship between the pain and the image results. Some of those patients experienced pain that worsened even after the herniations appeared to resolve via the MRI. And then some of them felt that their symptoms improved, even though the MRI showed that their herniations had worsened. So again, we really can't be counting on these imaging results to tell us what to do, right? There are other factors we need to be looking at.